that, I would like to introduce to you our first presenter, Mr. Bradshaw Isaac. So Mr. Isaac has 15 years of practical working experience in environmental health. He started his career as a public health officer in Jamaica and went on to work in the private sector in the bauxite, alumina, and power generation industry. Bradshaw joined CARPHA as a technical officer for occupational health and safety and indoor air quality. And he serves as the officer in charge for the Environmental Health and Sustainable Development Department, which is based here in St. Lucia. He has specialized training in industrial hygiene and hazardous waste management and disaster field operations. He serves on the CARPHA emergency response team as a wash specialist and has completed 2 missions to the Bahamas, and that's Abaco, in response to Hurricane Dorian in 2019. Quite an impressive bio there for Mr. Isaacs. So I now hand you over to Mr. Isaacs.
Thank you, Dr. Newton James. And good afternoon to all. I too would like to welcome you to our special webinar on water, sanitation, hygiene management during COVID-19 pandemic. This afternoon, we would like to take you through a series of topics. They include COVID-19, the current status. We'll look at water, sanitation, and hygiene. We also will be looking at COVID-19 and water supply system, COVID-19 and food, water, wastewater management and COVID, wash, and solid waste management in homes and the community, washing and solid waste management in healthcare and other institutional settings. And then we will share with you some of the CARPHA products that we have developed over the period of this pandemic. The objective of this webinar is to share information concerning COVID-19 guidelines for wash, sanitation, hygiene, and waste management in institutional facilities, including healthcare facilities, other organizations, and also to look at the home and the community setting. We are mindful, however, that the pandemic is not the only concern at this time. So it was pandemic during an active hurricane season. It is pandemic during a dengue outbreak in some countries. It is pandemic while some countries face water emergency crisis shortage. We also hear about community spread and transmission associated with non-compliance to government rules. We hear about home quarantine. We hear about respiratory clinics and so on. And each presents its challenge to public health, its challenge to the community setting. And so we will try to have as broad a perspective as possible as we present. What's the current status? Globally, well, as at October 12, World Health Organization reported that there was over 37 million cases of patients of COVID and a total of 217 countries reported at least one case. From a regional perspective, CARPHA member states, which consists of 24 countries, reported a total of 45,140 cases of COVID. The wider Caribbean region, which comprises 33 territories, including our CARPHA member states, reported 243,600 cases. And the rest of the world, which is global, again, over 37 million cases. This is just showing basically the same information as a breakdown. What would be considered as active cases. Route of transmission. So the virus can be spread by individuals from 2 days before until 14 days after the onset of symptoms. Precaution must therefore be taken to prevent human-to-human transmission of this disease. Currently, COVID-19 has been shown to spread mainly by respiratory droplets. This is through coughing, sneezing, speaking, singing. Also direct or indirect contact to infected secretions. These could be body fluids, saliva, nasal mucus, vomit, urine, fecal matter. Increasing evidence suggests that airborne transmission cannot be ruled out, and this is by the WHO findings. However, COVID-19 may be spread by individuals that exhibit no symptoms. Today, there is no evidence that the spread of COVID is by water, mosquito, or by food. Again, according to WHO, increased evidence here suggests that airborne transmission is possible. There's no current report, however, of fecal-oral transmission, and there's no current evidence that surface or groundwater is the source through which COVID is transmitted. Water, sanitation, and hygiene. The term we consider to be WASH. It is a collective term for water, sanitation, and hygiene. Due to their interdependent nature, these three issues are grouped together to present a growing sector. So they are separate fields, but because of the interdependent interrelationship, they are pulled together to be considered as WASH. And this relationship, for example, is shown if there is no toilet, no sanitary facility, then there will always be the possibility for contamination of water sources. If there is no clean water, then there can be no basic hygiene practice that is possible. So there is a total relationship, interdependence between all three. Water is the key for pandemic suppression and prevention. The provision of safe water, sanitary and hygiene conditions is essential to protect human health during all infectious disease outbreaks, including COVID-19 pandemic. Some water facts to share. 663 million people lack access to clean drinking water. 8 out of 10 people without access to clean water reside in rural communities. There may be some 159 million people using untreated water. World Water Day, we celebrate it March every year. World Water Week, August to September. Sanitation is essential to the survival and development. Some key sanitation facts: 1 in 3 people don't use improved sanitation. 1 in 7 people practice open defecation. This is saying that 5 countries, and they name the 5 countries, and it would appear that it is out of the region and we are not impacted. But then PAHO 2017 is saying that nearly 16 million people in Latin America and the Caribbean still practice open defecation. And that is a lot, and that represents implication for water, implication for sanitation as well. World Toilet Day is celebrated November 19 each year. Hygiene and hand washing can save life. A simple practice just like hand washing actually save life. Good hygiene practice reduces incidence of pneumonia, scabies, skin and eye infection, diarrhea-related diseases. So this is even broader than the COVID pandemic that we talk about. Simple hand washing and hygiene prevents quite a bit of disease. But there is a cultural and a behavioral aspect to hygiene. And we need to address this in order to ensure that persons are in compliance or practice voluntarily proper hygiene. It is a gradual process. It involves working closely with communities, need to define motivational strategies, look at the tools that can be developed to encourage positive practices. There's a global hand washing day, and this is October 15 every year. There are some key players in the wash sector that's worth mentioning. CWWA, which is the Caribbean Water and Wastewater Association. There is CARPHA, which is the Caribbean Water Storage Association. There is WashLock, which is Wash Latin America and the Caribbean. There is PAHO, WHO, and of course there is CARPHA. But we need also to involve the players at the national level. And these would involve the water providers, water, wastewater operators, solid waste management operators, environmental officers, health officers. Those are key players in the sector. So improving access to sanitation requires a multi-sectorial approach, and there is need for multi-sectorial policy and action to prevent disease and to save lives. And so it is important that both regional level and the national level would meet to mitigate these actions. At this juncture, I'd like to introduce my colleague who will continue our presentation in the area of water system, sources to customer. I introduce Dr. Kim Newton-James. She's currently the Technical Officer for Chemicals and Solid Waste Management at the Environmental Health and Sustainable Development Department here in St. Lucia. She serves on the CARPHA Emergency Response Team. Prior to joining CARPHA team, she worked as a consultant for CARPHA, Waste and Chemicals Management Specialist, on a regional project. Dr. Kim Newton-James, she holds a doctorate and a master's in environmental toxicology with a BSc in biochemistry. She is also the proud recipient of the prestigious US Fulbright Scholarship. Before working with us at CARPHA, Dr. Newton James was a science lecturer at the Sir Arthur Lewis Community College. Part of her motivation for moving to CARPHA was her interest to link environment and public health. I turn you over to Dr. Kim Newton James. Thanks.
Okay, thank you so much, Bradshaw. Very nice introduction, I must say. So for my presentation, we're going to look at COVID-19 and the water supply system. So in other words, COVID-19 and looking at that centralized water system. So the regular water system you get with your piped water. And we're going to focus on it from the source straight down to the consumer. So in looking at potable water, we know definitely safe drinking water, sanitation and hygiene, in other words, safe wash, are crucial to health and well-being. And it is also a prerequisite for health. And it will, as you know, contribute to livelihoods. It also helps to create that sort of resilient communities and safe environment for us. So according to current research, the COVID-19 virus is not detected in potable water supplies, and potable meaning clean water, drinking water, treated water. The research is saying that the risk to the water supplies is low. And this is as a result of the conventional sort of treatment that we use in the water supply system, or the centralized water system, which is basically filtration, disinfection. And they're saying that this risk is low because in going through this process, it actually destroys and inactivates the virus. So when you look at the water supply system and public awareness, this is important, and it is crucial that efforts be made to, first of all, notify the public, notify critical sectors, on the condition of your water supply system. And in doing so, you'd want to issue guidelines on measures for water purification if there's contamination or if contamination is suspected. Also, you would want to identify alternative sources of potable water, because in the Caribbean, some of us don't depend on water from a centralized system. We have another source of potable water. Also provide information on the best practices if water must be hauled or trucked. And finally, educate households, and this is all part of the awareness, on the safe storage and cleaning practices. So these last 3 bullets, I'm going to go into a little more detail as I approach other slides. So when you look at measures to improve water safety, you start from the water source. So basically you're thinking about protecting the water source. That is the catchment. That is where you get the water initially from. So for example, your water source may be your river. It may be an underground source. It may be a spring. It may be the sea. Okay, and when you're talking about protecting this water source, you're talking about protecting it from pollution, from sort of contamination, whether it is chemical, biological, for example, pathogens, right? And one way of ensuring that we improve the water safety is to treat the water at the point or before distribution. And this is what is exactly done in your water supply system. Also, to improve safety of water, you store the treated water in clean or regularly cleaned containers, and containers that are covered as well. And in terms of treated water, so you hear treated water, we're talking about disinfecting the water, disinfection. And in disinfecting your water, or treating your water, you must ensure that there is residual chlorine of greater than 0.5 milligrams per liter. And what's important also is the contact time. And this one says 30 minutes contact time at a particular pH, which is 8.0. And you must ensure that this is maintained throughout the distribution system. And this happens in your water supply system, where you have checks at various points in the distribution network where you check for this sort of residual chlorine, because this ensures that your water is potable, the water is safe, and you want to ensure that it is in this sort of range. So we spoke about centralized system, but as I mentioned earlier, some countries, some places, you do not have this sort of centralized system. However, there's still a possibility of treating your water and getting rid of viruses or pathogens. And some of the technologies involved would be boiling, filtration, and you have a lot of different filtration methods with different sort of membranes, okay, ultrafiltration. You also have irradiation with UV light, or whether it is solar irradiation. And finally, of course, which everybody knows, is chlorination. But at the household level, you may find yourself having to treat your water. Okay, so this refers to water disinfection at the home when you have 5 gallons or less, or 5 gallons or less, yes. So some of the techniques or methods for disinfection is boiling, disinfection tablets, as purification tablets, bleach, and this is a normal household bleach, and sometimes you could get the ones that are unscented. There's also iodine and filters. So rainwater harvesting is another source of safe water, right? But the thing about rainwater harvesting, in order for you to minimize the risk, you have to practice good hygiene. So this system has to be supported by good hygiene. And one of the first things you'd want to do, or to ensure, is that the system is well designed. Okay, in other words, you have a clean catchment or a clean source. So your catchment in this case could probably be your roof or your roofing system. This is where it rains and the water collects on the roof, and then it goes somewhere after that. Okay, your cisterns. So sometimes your cisterns can be above ground, sometimes it can be underground, below ground. All right, so you have to ensure that your cistern is well designed. In the case of underground, you don't want it leakage, okay, from underground, because you can get contamination if you have walls, and you can get penetration of anything that comes to the soil. Also, in your above ground, okay, you'd want to ensure that it is covered, protected, etc. And this also goes for your storage tanks, okay? Because rainwater harvesting is a good method and another source of potable water, and it can provide the safe water. And as I said before, once you follow good hygiene, you're almost there. And the rainwater is relatively free from impurities. It may pick up impurities as it falls, especially if you in an area where you have a lot of open burning, so you're going to have a lot of soot and particles in the air. So the water is going to pick this up, okay? And also this would cause deterioration of the quality of water that you're going to harvest. Also, you can get dirt particles and sand getting into this water. So for example, when you have incidents like the Sahara dust incidents, you have a lot of dust particles in the air. When it rains, this will get into your water. However, this will get into your water, yes. And the thing about these dust particles is that they can carry pathogens on these particles as well. But the thing about having a good a well-designed system, it will, capture these particles at some point, whether it is through filters or some other method, okay? Other forms where you can have deterioration of your water would be where you have a lot of animals, for example, birds, where birds are on the roof, so you get birds droppings, you have insects, and sometimes you have what we call roof rats, okay? And if the rats are about, you're gonna have a lot of urine and defecation. So just imagine all of this getting into your cistern or your water. And also there's litter, leaves, and so forth. So what are some of the recommendations for safe rainwater harvesting? So we know the first one, you have to have that system well designed. right? Clean catchment surfaces and gutters regularly. So knowing all of this, there must be that regular cleaning of your roof. Place a wire mesh in the inlet filters or over the top of the downflow pipes. Okay, and this is gonna capture a lot of the debris, the leaves, and so forth. Clean your gutters regularly to prevent clogging as well. Again, very important, and as part of the design, you want a system and you design it in such a way that you divert the first flow of water. So sometimes, you know, when it hasn't rained in a long time, okay, you'll get a lot of stuff piling up on your roof and stuff. So even if it's not clean, what happens with that first flow, everything that's on your roof or your roof collecting system is going to get into your water if you don't have your wire mesh and stuff. So there's this first flow which diverts that first set of water out of your cistern or out of the water that you collect from your roof. So also very important, ensure that the materials used in the catchment, and that's on your roof and in your storage tank, they are approved. And you're not gonna have metals and substances leaching into the water. Cover your storage tank, so that refers to an above ground tank. So you want to cover your tanks to prevent mosquito breeding or fecal contaminants, etc. Avoid sunlight, and this again refers to above ground tanks, which will promote algal growth. So what you hope is that you have dark colored tanks or black tanks, or even sometimes concrete tanks. And treat at the point of consumption to ensure better quality of water. So you disinfect. And in some cases, in a lot of cases, the disinfection is via just household bleach. But of course, there are particular measurements that you would follow. So when it comes to the COVID-19 virus and this pandemic, we know that combating and fighting this pandemic requires a lot of water. Okay, and so therefore, you know, there's going to be a likely increase in water demands for public health and human consumption, because we keep saying, yes, you have to hand wash, you have to clean facilities regularly. So of course, there should be, you know, there should be that increase. And I'm sure if we probably collected data, we might actually, you know, see this sort of increase. But then just getting back to the point, in the Caribbean region, we know water scarcity is an issue. Water security challenges are experienced by countries, and they have their own unique experiences with these challenges. However, when you look at these countries, some of the challenges that are common to the region include infrastructural issues where you may have damage or disruption to the pipelines, and as a result of hazards, water-related hazards, for example, flooding. Okay, you have great demand for water. Sometimes the service is inefficient. You have leakage along the lines, which makes the water supply system vulnerable. And this is why right now the push is towards countries developing water safety plans, and even a step further, in light of climate change, in light of water scarcity, to develop climate resilient water safety plans. So in developing these water safety plans is going to take all of this into consideration. Even a pandemic, it will take into consideration to ensure that the water that is supplied to the consumer is safe for drinking. Also, it is important to explore, and we mentioned this earlier, various other sources of water. If you know there is scarcity or you have water security issues in your country, yes, this is valid. This is very valid. Okay, so in terms of household water storage, some of the recommendations are, and I mean, all of us, I'm sure, in the Caribbean, this is something very common, have tanks. The thing about tanks is that you must ensure that whatever tank you purchase, the material of the tank is a food grade standard. And I don't think we have too much of a problem with that in the Caribbean, but yes, it must be of a food grade standards. In other words, it must comply to the standards. So when the water gets into contact with this material, there's no leaching of substances in the water and thereby compromising the safety of that water. Drums, okay, a lot of us in the Caribbean, this is not something new to us, we use drums. What may be new is us labeling the drums, and this is recommended that you label your drums, you label it drinking and non-drinking use, right? So then you know what you can do, what you cannot do, okay? Because you wouldn't expect for non-drinking use, if you're just gonna use the water to flush toilets and stuff, I mean, you would probably use containers to just dip into it, but you wouldn't want to do that with your drinking water. All right, so this is why it's important for you to label it. You want to mark the date of the storage, because you don't want to have water in this drum for a long period of time, which can cause the water to stagnate. And then, you know, after a while, you will have to check to see that this water is still potable. All right, that is the residual chlorine level is what it should be. Again, place your tanks in a dark location, and this is again to prevent algal growth. And very important very relevant right now is to cover the tanks to prevent mosquito breeding. And so for regular tanks now, install to include a backflow. And this point is actually referring to the rainwater harvesting system, because sometimes and in some countries you have somebody or institution that has a rainwater harvesting system, and it is connected to your actual centralized system or your water supply system, right? But then what they advise in here is that you have a backflow valve, and this backflow valve is very important because what it does for rainwater harvesting from going into the centralized water and vice versa. Because if there's contamination at either end, then you contaminate everybody's water. So you should have connections to your tank that is being continually used, and not the water is not allowed to stagnate. So emergency water supplies comes into play after a disaster. COVID era right now during the COVID pandemic, where your water can become contaminated, or you just, the source is no longer there and it can't be used. So this is why you need to plan for alternative sources and put these things into place. And remember I mentioned the water safety plan. So a water safety plan is going to take all of this into consideration, or your water safety climate resilient plan is going to take all of this into consideration. So how much emergency water to store? You store at least 1 gallon of water per person per day for 3 days. And that water would be for both drinking and sanitation. But also, to be on the safe side, you should store a 2-week supply of water, and even more water if you know you have a pregnant woman in the house or your household, or you have persons that are sick or that are vulnerable to illness. So, talking about emergency water supplies and talking about scarcity of water, you definitely have the need for water haulers. And we do use water haulers in the Caribbean. And here, these are some recommendations for the water haulers. Okay, the first of all, and remember, always think of guaranteeing portable, safe, treated, clean water. So you basically, these haulers need to maintain the trucks in a sanitary condition. And that means regular cleaning of the trucks. That means using the trucks for dedicated water-only transport, cleaning the hose regularly, disinfecting the hose, I should say, regularly. All right. So in other words, trucking water hauling water should have some sort of water safety plan as well. All right, and I know in some countries in the Caribbean here, they tend to monitor, the health department monitor some of the truck drivers. Okay, so in doing that, you can actually provide certification for them. And I think some countries is moving in that direction. Okay, so that you can ensure that they're not adding to the problem. Because I've heard in some cases that, you know, people trucking water, when you get the water, you finding out later that they just went to the river and they got the water. I don't know how true that is, but, you know, but you, as I said, you don't want them to be part of the problem. So again, so do not use septic haulage tank trucks to transport potable water, nor vice versa. So as I said earlier, it should be dedicated for that, for transporting potable water. Maintain all equipment and the surfaces intended or that comes into contact with the water, you maintain them in sanitary conditions. So that means you have to be disinfecting your hoses. Sometimes your hoses, if it falls on the ground, you have to go through the whole process of disinfecting it, etc. All right, and disinfection, as I mentioned earlier, simple household bleach. You just need to know the measurements. And obtain water, and very important, obtain water. These truckers or water haulers, you must ensure that the water is obtained from an approved source and delivered to the user or to the consumer. So an approved source, meaning they get the water probably directly from the water supply system or the water supply service system, okay, or the centralized piping water system. All right, and they too have to do checks on the free residual chlorine in the water. All right, so definitely we need to protect the water resources we have, and these are some recommendations for protecting the water. So ensure the system of water storage are protected from animals, pathogen, children, people. Avoid dipping into your storage units. You store your water in covered containers, and we saw the reason for that as well. So not only mosquitoes, also getting contamination from the air, whether it is pathogen or chemicals, gaseous compounds. Ensure the storage containers have narrow openings or fill-ins and sprouts, also reducing, you know, potential contamination. And then you don't have to go dipping into it as well. Ensure the size of the container is appropriate for your water treatment, whatever method that's chosen. Make sure that you follow instructions, especially if you're treating your water using chemicals like bleach to treat it. And ensure larger storage containers for communal use have close-fitting covers and are kept in protected areas. Okay, so just to remind you, if you have any questions, please place it in the chat, and this goes for both this session as well as Mr. Isaac's session. So next up, our next presenter is Mr. Kareem Charlemange. So Mr. Charlemange graduated from Sheffield Hallam University in the United Kingdom in 2013 with a BSc in Forensic and Analytical Science. Now this I didn't know, so I'm actually learning some new things about my colleague, and with first class honors, impressive. Since then, he has worked in a variety of industries, from IT, yes, and he is our everything person, so any issues we call on Kareem. Yes, IT issues. So from IT and to the maritime industry, didn't know that as well. And also he was a lecturer at a medical school, right? He joined the Environmental Health and Sustainable Development Department of CARPHA as a laboratory technologist in September 2007. And he currently serves as the lab manager of the Environmental Health Lab. So I must say, very impressive. And he's also one of our younger members of staff. So kudos to you, Kareem. So I now hand you over to our able Kareem Charlemange.
Thank you, Dr. Newton-James, for that lovely introduction, and a pleasant good afternoon to everyone here who has joined us this afternoon for this webinar. I'm really happy to see such a positive attendance. So in my section of this webinar, I'm going to touch briefly on COVID-19 and food. I'm going to touch on wastewater management, a little bit on sanitation and plumbing, treatment and handling of human excreta, and cleaning facilities. So first thing we're going to talk about is COVID-19 in food. As discussed earlier, there is no evidence to suggest that COVID-19 is transmitted through food. There's not a foodborne illness, and we discussed the routes of transmission earlier. So that's one less thing to worry about. However, the virus can land and remain viable on different surfaces, which includes food and its packaging. This was evident in previous coronaviruses, which have shown to survive for up to 2 years at -20 degrees Celsius. As such, proper food hygiene and safety practices must be implemented in food establishments to help prevent the spread of the virus. So this entails proper hand hygiene, use of gloves, cough and sneeze etiquette, and masks are all key practices we can use to combat the virus. So some helpful tips for food establishments. If you work or manage a food establishment, some steps you could take is limiting the number of staff in the preparation area at any one time, and space out workers to maintain social distancing. Engage in more frequent cleaning schedules. This will be done particularly at the beginning of shifts, regularly throughout the day, and particularly after any event that causes the station to be soiled. Raw and uncooked or unclean food should not come in direct contact with takeaway or delivery bags. And if you have food delivery workers, they should practice good hand hygiene between deliveries and handling payments. Another step you can take is to consider additional layers of protection by sealing off your delivery bags with tape, staples, or not, just an added layer of protection. We also have produced a few guidelines on COVID-19 and food safety and COVID-19 in the food and beverage industry, which we'll be talking about later in our products. And these go into a lot more detail for tips and guidance as to how to help manage the spread of the virus if you work in these industries or establishments. So COVID-19 and wastewater management. Research shows that the virus which causes COVID-19 can be found in the feces of diagnosed patients by the 3rd day of infection. And they tend to last as well, because similar coronaviruses in the past have been detected in untreated sewage for up to 14 days as well. Luckily, the previous knowledge from these coronaviruses also show that normally implemented disinfection techniques such as chlorine dosing procedures would help deactivate the virus. So if you work in the wastewater industry, some tips for safely managing wastewater and fecal waste. Wastewater carried in sewage systems should be treated in well-designed and well-managed centralized wastewater treatment works. In these wastewater treatment plants, each stage of treatment, as well as the retention time and dilution, will result in a further reduction in the potential risk of spreading the virus. A waste stabilization pond is a practical and simple wastewater treatment technology, which is well suited for destroying pathogens. This is because in these wastewater treatment stabilization ponds, you normally have a relatively long retention time, about 20 days. And they're also exposed to sunlight, elevated pH, and biological activity, which are all steps that contribute to pathogen destruction. As such, it is not recommended that untreated wastewater be released into the water bodies or the environment by extension. Unfortunately, this is a practice we see that does happen sometimes, and if it does, there should be adequate and appropriate signage preventing the use of contaminated areas by the public. If you work in the wastewater management sector, there's no need for any COVID-specific protections. This is because viruses are normally present in fecal matter in wastewater anyway, and the coronavirus is susceptible to similar disinfection conditions as other viruses. Therefore, the current disinfection techniques that are being used, such as chlorination or irradiation with ultraviolet radiation, are more than suitable for treating COVID-19. So there's no evidence to suggest the need for COVID-specific protections. And wastewater treatment plant operations should continue to ensure that workers follow standard protocols, safe work practices, and don correct PPE, which is normally required when handling untreated wastewater. And just to touch on this, some of the required PPE would be your goggles to protect your eyes from the splashes of human waste, your face shields to protect your nose and mouth from the splashes, liquid repellent coveralls to keep human waste or sewage off your clothing, waterproof gloves, and waterproof boots as well to continue protecting yourself. As such, workers should wash their hands with soap and water immediately after removing PPE. So this section talks briefly about the wastewater treatment, wastewater management, and of feces and human wastewater. But if it gets to the treatment plant, that means it would exist in your homes, in your toilets, and in your facilities. So what happens before? What about before it gets to treatment? How do you safely? Would it really affect or pose a risk to you in your household? Well, honestly, it might, because faulty plumbing and a poorly designed air ventilation system were actually implicated as contributing factors to this aerosolized SARS coronavirus in a high-rise apartment in Hong Kong in 2003. So ensuring that your sanitation facilities in your offices, in your homes, in your buildings are properly maintained and monitored are also steps you can take to ensure that you are reducing the risk, not only yourself, but your friends and your family and your co-workers. The Lancet Global Health recommends the following steps to be taken to ensure that transmission through wastewater plumbing system is minimized. If you begin to get a foul smell from your bathrooms, your sinks, or your wash areas, do not ignore it. Try to get a plumber or someone in there as soon as possible to rectify that, because that could be an avenue for disease spread. You ensure that all your water appliances in your bathrooms or kitchens are filled with a functioning U-bend. If you look under your sinks in your homes, hopefully you would see this U-shaped bend before the pipe goes into the wall. So this U-shaped bend creates what is called a water trap seal. Now, in the bottom of that U-shaped bend, you have water which is kept in there. This water serves as a seal for any vapors or any aerosolized components coming back into your sink and up through your drain and being spread. So to prevent the loss of your water trap seal within a U-bend, you should open the tap on all water appliances for at least 5 seconds twice a day, morning and evening, and pay special attention to floor drains in bathrooms and wet rooms. If the wastewater pipe from an appliance appears to be disconnected or open, seal it immediately. You can use an elastic rubber glove. You could use a piece of plastic bag and some rubber bands to seal it off, ensure the bag has no holes. And if there appears to be any crack or leak in the pipework, seal with tape or glue and continuously monitor the whole system performance. If you have to handle human excreta, we have some guidance for you as well. Clean an area with normal household disinfectant after someone with suspected COVID-19 has left will reduce the passing of the infection to other people. If you do have to clean these areas, please wear disposable or washing up gloves and aprons for cleaning. If you're using any reusable items, please ensure that they're adequately disinfected after use. If you're disposing of items, they should be double bagged and stored securely for 72 hours before being thrown away with your regular rubbish. Regular household soap and detergent should be used for cleaning first, and after rinsing, household disinfectant containing at least 5% sodium hypochlorite should be applied. If you're wondering what exactly is 0.5% sodium hypochlorite, it's 1 part 5% household bleach to 9 parts of water. That will be adequate and an adequate disinfectant solution. If you, when cleaning, use a disposable cloth. First, clean hard surfaces with warm, soapy water. Then disinfect surfaces with the cleaning products you normally use. Pay particular attention to frequently touched areas and surfaces such as bathrooms and other bedroom furniture, guardrails in corridors and stairwells, door handles, bedside tables, bed frames, etc. Bathrooms should be cleaned and disinfected at least once a day. And when cleaning an area that has been heavily contaminated, such as with visible body fluids from a person with COVID-19, use protection for the eyes, mouth, and nose, as well as wearing gloves and an apron when performing these tasks. Wash hands for 20 seconds with soap and water, or otherwise practice proper hand hygiene with an alcohol-based hand sanitizer after removing gloves, aprons, and other protection used while cleaning. Toilets and handling feces. It is critical to conduct hand hygiene where there is suspected or direct contact with feces. If your hands are visibly dirty, then soap and water are preferred to the use of the alcohol-based hand rubs. If you're dealing with a patient or a relative that is unable to use a latrine, excreta should be collected in either a diaper or clean bedpan and immediately and carefully disposed of in a separate toilet or latrine specifically used for suspected COVID-19 cases. Feces must be treated as a biohazard and handled as little as possible. Anyone who has to handle feces should follow WHO contact and droplet precautions. Use PPE to prevent exposure, including long sleeve gowns, gloves, boots, masks, goggles, face shields, etc. If diapers are used, they should be disposed of as infectious waste, as we said, and specific facilities for suspected COVID-19 cases should be used for disposal. Guidance for cleaning toilets. This is something you could take with you in your homes, in your offices, wherever you may work, because these are really key tools in order to help prevent the spread through human waste. Even though the risk of getting infected with COVID-19 through these methods is low, but it is better to be safe than sorry, and ensure that proper sanitation, hygiene and sanitation in your washrooms is adhered to. So when you're doing it, when you're cleaning your toilets, you should wear disposable protective gloves. And if you clean the toilet bowl itself, you try to wear those long protective gloves that go all the way up to your elbow, and you wear those on top of your disposable gloves. These long gloves must have a designated container in a cleaning cart, which is separate from your rest of your supplies and can be easily put on without touching the outer surface of the gloves except for the opening at the bottom. Put the disposable gloves worn underneath the long gloves in the waste bin after you have cleaned the toilet. So what would you clean in your bathroom if you were to clean after someone who was COVID infected, or just as a general practice, you'll clean everything. We're talking about the door handles, the taps, shower, countertops, basins, mirrors, walls behind basins, paper and soap dispensers as well. So literally any and everything you can clean in there, you do, and you pay special attention to cleaning high contact surfaces as well. To clean the toilet itself, you apply a small dose of detergent in the toilet bowl, both sides of the lid and the seat. You close the lid and you flush. Apply toilet bowl cleaner on the bowl and its vertical surfaces while paying attention to stains. Wash the brush when you touch the toilet, clean out the outer surfaces of the bowl and any stains with a cloth. You put the clean cloth in the laundry bag and use a disposable cloth, the clean cloth in the laundry bag, or use a disposable cloth. Disinfect your long gloves and put them in the designated container. Put the disposable gloves in mixed waste and put on new gloves. Wipe the floor with your cleaning equipment and wipe the floor with cleaning equipment and the multi-purpose cleaner, and that's it, you're done. Try to avoid touching anything once you've done cleaning, and that's it. So these are the general guidelines you could use for cleaning your spaces, cleaning your personal spaces, as well as any establishments or offices or anything like that that you would be using or have to be in the presence of. So that takes care of this section of the presentation. I'm going to invite Dr. Newton-James back to speak to us about wash and solid waste management in healthcare and other institutional settings. So, Dr. Newton-James.
Okay, great. So I'm back again. So this sort of shifting and movement is just to keep you, to keep you going, to keep you awake and alert and make sure you're still here with us. So we're keeping you on your feet. Okay, so as Kareem mentioned, I will be looking at wash and waste management within the context of the institutional setting, for example, your healthcare and your hospitals. So Kareem would have gone into a lot of detail related to toilets, excreta, and before you would have heard also a lot on cleaning, sanitation, disinfection, and solid waste management. So all of these are still relevant in this sort of setting. But however, this presentation is going to focus on key recommendations for when you have suspected or confirmed cases in your healthcare and hospital and similar institutions. So in the first case, when you look at toilets, provide separate flush toilets with a door. And this is a simple recommendation. It's a key recommendation because you don't want, when you flush the toilet, all of these aerosols go into the air, and then you have the door open, and then, somebody else come to use it right after that, and, there's problems right there. So flush with lid down as well to prevent that droplet splatter, that aerosol cloud that you definitely want to avoid. Disinfect twice daily by trained trained cleaners wearing PPE. So that's a lot right there. So you have to clean twice a day. That means clean regularly, and probably at least twice a day according to the traffic you have using that particular toilet. Trained cleaners, so then you would have to have some sort of meetings or getting your staff the information, and this is the hospital staff, the healthcare staff, information on the proper cleaning methods, what, how to dilute the chemicals, etc. And very important, and we keep hearing this, the wearing of the PPE, how to don and doff your PPE, what is appropriate PPE for different cases. Designate, very important, designate separate toilets for healthcare workers, because you don't want your workers, first of all, to be exposed to that potential or to that risk. Okay, so you would want them to, although they take all the necessary precautions, you still want to have some sort of separation in the toilets in the facilities. And these, of course, should be labeled, and, the individuals made aware, okay, these are toilets for this potentially infected persons or persons with that that are positive for the COVID-19 virus. In terms of excreta, Kareem did go through a bit of this as well, but the focus, as I said, is for institutions, health institutions. So clean, disinfect, rinse your bedpan after disposing of excreta. And whether you dispose of it in the drain, which should be connected to the sewer septic system, and or toilet. Ensure that definitely there's no contact with the patient's excreta. This is why your PPE is important. Practice hand hygiene regularly. So even if you have your PPE on, yes, you still need to practice hand hygiene. Also in terms of this excreta, you want to remove the solid excrement from soil linen and placed in a covered bucket until it's ready for disposal in the toilet. And then there shouldn't be too much of a long period between that. So you want to make sure that this is timely. It's like you don't want there to be any buildup of this sort of item. So in terms of cleaning practices, when it comes to things like laundry and the surfaces, at least once daily and upon the patient discharge. So that is at least. So it can be done better, more in light of your traffic and the number of people you have in the area at the time. So disinfect small areas between uses using 70% ethanol. And also you would want to ensure that any sort of reusable equipment, dedicated equipment, for example, thermometers, get that same sort of sanitation and cleaning. So disinfect surfaces with, and I think Kareem mentioned this as well, using 0.5% sodium hypochlorite. And again, very important, and I'll keep saying it, wearing appropriate PPE before touching soil bedding, towels, clothing, anything that has to do with the COVID-19 patient. And it says appropriate, so you use heavy duty gloves, mask, eye protection, long sleeves, just basically protecting yourself as well as best as can. Other recommendations when you look at the cleaning practices, the soil linen, you'd want to place in label leak-proof containers, and these health facilities are good at that, and they sometimes use color-coded bags as well. Remove solid excrement from linen. Machine wash, and then you're going to wash at a particular temperature using your detergent. An alternative is to use hot water and soap in a large drum, and then you take the necessary precautions using a stick to stir. When you empty the drum, you want to make sure you empty it so that it doesn't go into the environment, but it goes into that drain or the sewer system. You want to soak this linen in 0.5% chlorine. And then remember, again, you mentioned contact time is important, especially when you're disinfecting. So remember the contact time. And then you would rinse in clean water. So these are just some of the key recommendations in terms of your cleaning. So when it comes to safe disposal of gray water and washing water, you know you have a lot of these. And I keep mentioning, yes, you have to dispose of these in your septic system or your sewer system. Because remember, this water is going to contain disinfectant and chemicals, all right? And for that reason, you don't really need to rechlorinate before you toss it in the sewer or the septic system. So clean, utility, heavy-duty gloves, reducible plastic, reusable plastic aprons. So yes, there are PPE that you may have to reuse, and these are usually the heavy-duty utility ones. And then in terms of that, you have to decontaminate them. And again, you use 0.5% hypochlorite solution, and you decontaminate after each use. However, for single-use PPE, for example, gloves, gowns, these should just be not used, and they should be thrown away. And there were cases where initially you heard countries had to be reusing PPE. All right, but these are sometimes warranted in light of the lack of PPE. But again, you still try to decontaminate them as best as possible. So practice hand hygiene once the PPE is removed. Very important. So in terms of waste management at your healthcare facility, we know from current research that there is no evidence that direct unprotected handling of healthcare waste causes the spread of COVID-19 virus. So in light of this, or despite this, we use best practices for safely managing healthcare waste. And you have to therefore assign sufficient resources to dispose, to collect, to decontaminate this sort of waste. And this waste associated with COVID-19 is considered clinical waste, it's considered infectious, it's biomedical waste, and it has to be treated as such. So you would want to safely collect this waste, and you're going to collect it separately from the regular waste that is generated in the healthcare facility or the hospital. You collect it in designated bags, just as you will do for the laundry. You have designated bags that you will collect it in, and this will be color-coded as well. And in some institutions, you can treat it there on the compound safely. For example, we have some hospitals, healthcare facilities, not so much, but some hospitals where you have autoclaves and you have incinerators. So you could actually treat the waste before you store it for disposal. If not, then you will have probably to store it. And when you're storing it, you would want to store it in a place that is first off-site. It's away from your animals, it's away from people, so you're not going to have people and animals getting into that waste and spreading it around. So you also want to wear appropriate PPE again, and perform hand wash and hygiene after removing your PPE. So my next few slides looks at the impact of hand hygiene in hospitals, healthcare, and healthcare facilities. So I think this is very important, and I found this very interesting, this part very interesting. And when Bradshaw presented, he did mention how important hand hygiene was. So there was a study done in 2019, and where when they looked at hand hygiene and the increase in hand hygiene, when they looked at that, when they increased hand hygiene rate, they saw that healthcare-related infectious diseases increase. So when one increased, the other decreased. So this is how important we see hand hygiene is. So proper hand hygiene is the most effective and cheapest means to prevent infections at hospitals and healthcare facilities. All right, and in the healthcare setting, hand washing and hygiene may differ a little slightly from regular hand washing, because one thing that is required is removal of all jewelry, watches, etc., because this could actually prevent proper hand hygiene. So you would see these individuals remove it, or they don't place their jewelry on until at the end of their shift. And training in the correct technique is important. And when I say training, I'm talking about in terms of following the WHO guidelines for hand washing and hygiene. So water, all the different things we use for hand hygiene: water and soap, disinfectant, alcohol-based hand sanitizers, are not adequate in all situations. Right, and remember, this is framed in the hospital and the healthcare setting. So alcohol-based, and this is according to the same study in 2019, they're saying that alcohol-based hand sanitizers had the greatest and the longest effect compared to water and antiseptic soap. And the antiseptic soap in this study was chlorhexidine, 4%. And it was also more effective than regular water and neutral soap. All right, so different situations, different agents. So the recommendations, and this is in a hospital and specifically to surgery. So just to show you, yes, it's slightly different, but we kind of approach the same sort of hygiene as well in other institutions, but these would apply also for health care institutions. So use alcohol-based sanitizers, followed by antiseptic soap before putting on the gloves. Use alcohol-based sanitizers, then apply gloves if the water is not portable. And this is a very important point because we keep saying, yeah, practice good hand hygiene, right? And you know you need a lot of your agents, or you need, and you always need water. But this water has to be portable water, it has to be treated water, it has to be clean water, right? And we'll get to that in a while. And also, you use long-lasting hand sanitizers to apply to hands, especially when you have dry hands. So we know in our pipe system, okay, we have pipe system or centralized systems to our hospitals, and these systems can become contaminated, and we saw how when you have floodings and stuff and you have structural damage to your pipelines and stuff, so they can be damaged in the hospital, so and your healthcare facilities. So it's always a good idea to have protocols that include cleaning of the pipelines, cleaning of pipes, right? Use of alcohol-based hand sanitizers, again, is the most effective methods in the healthcare facility, and hospitals included. And in instances where you have visibly dirty hands, and also, of course, in surgery and where the quality of your water is poor. So in the healthcare setting, use of hand hygiene, okay, you use it before, and this is guidance, you use it before and after contact with the patients and the surrounding, because you can get secondary infections or secondary transfer, by fomite transmission, where you touch a surface that was in contact with some infected person and you have sputum or whatever on that surface. So there's that form of transmission. So also gloves do not replace proper hand hygiene. So even if you have gloves, before putting on the gloves, you have to wash your hands. When removing your gloves, you must wash your hands or practice proper hand hygiene. So clean hands before, clean hands after use of gloves. So hospital and hospital care rooms must have some sort of, hand sanitizer dispensers in the vicinities of where you keep these patients, or on the wards or in common areas. And WHO recommends the use of alcohol-based hand sanitizers with a minimum of 60%. So that is the minimum of 60% alcohol. So in some cases, you can go up to 85%, which is good. However, do not use pure alcohol, because pure alcohol is toxic and when absorbed through the skin. All right, and with that, again, I will urge you to place your questions in the chat so we can get to them. So now, as I said, remember I said we're going to keep you on your feet. So we're winding down as well, and our last presenter would be is Mr. Bradshaw Isaacs. So I hand over to you, Bradshaw.
Good afternoon again, everyone. And so I will bring closure to the presentations. The final subject, wash practices, solid waste management in homes and communities. Just to mention, in the earlier presentation, I mentioned some concerns that were at the community level. Where's that community spread, home quarantine, There's also mass gathering in some communities. We mentioned open defecation with the possibility of causing contamination to sources, non-compliance of persons that are within quarantine setting, either home or elsewhere. And most importantly, we mentioned the importance of behavioral change and hygiene. So a lot of what is needed to stem this whole issue of preventing the transmission of disease resides at the community and the home level. And so we need not only to focus on national initiatives, policies, and directives, but we need to find some way to ensure that we create awareness of the issues that we are having at the community and at the home level. So for this last presentation, I'll just basically be taking you through some of the areas. They have already been mentioned, because if it is hygiene and sanitation, it would be common in certain places. Wash practices in home and community. Consideration of holding the best wash practice in home and community is also important in preventing the spread of COVID-19. And we mentioned that it's not only COVID-19 because we're having the pandemic, but it prevents health and disease, health issues and diseases for many other, in many other areas. So when caring for confirmed cases at your home, it is significantly important that we consider certain measures. And regular and correct hand washing is of particular importance. So we cannot overemphasize the importance in proper hand hygiene in combating COVID-19 and other diseases. How to properly wash the hand. Kim went into details with that. You'll all be privy to the slides, and so I'll pass this one. But recommendations for clean public spaces. And public spaces may be, for example, the very respiratory clinics that you may be going. It can be entertainment facilities. It can be food establishment or bars. It can be marketplaces, any such areas. It is important. And if we should consider, for example, that the disease is transmitted by contact to surfaces. If we are not aware or know who are persons that are infected, what are the possible surfaces that may be infected, then at the community level, we need to be particularly vigilant in protecting ourselves in order to prevent further spread of the disease and community transmission. So we need to be mindful. So recommendations for cleaning public spaces: you need to choose products that clean, disinfect in one. Use only cleaning chemicals approved by the local authority. Follow the manufacturer's instruction for safe use of cleaning and disinfecting products. And these instructions, usually with a particular chemical, there is usually a safety data sheet or material safety data sheet. We need to look at these chemicals, see exactly how it is supposed to be used. What are the protective gears that are required? Should it be used in a well-ventilated area? What is the contact time? What should we do if there's a spill and things like that? You'll get all that information and so on. Allow enough contact time for the disinfectant to kill the particular germs. And then again, particular chemical would have particular strength. And so it is important that persons that are engaged in cleaning of public or even private facility should be trained appropriately that they would be aware of the chemical that they are using. They would be aware of what is required of them in terms of leaving the chemical at a particular strength for a particular time, how to properly dispose of the material and so on, how to properly mix the chemical to get the effective outcome and at the same time protect themselves. Wash hands with soap and water and use alcohol base and sanitizer after removing gloves. Use damp cleaning methods. Place contaminated disposable cleaning items, example your mops and cloth, in a lined garbage before disposal. Wash reusable cleaning items with laundry soap and hot water at temperatures of 60 to 90 degrees Celsius. Clean and disinfect frequently touched surfaces, and this is very important. Clean shared surfaces or shared spaces. For example, kitchen and bathroom where they're communal use, you'd want to clean those more frequently as well. Solid waste, safe management of municipal solid waste. Solid waste management workers, they should handle waste with precaution. You can never know where the particular waste is coming from, if it is impacted, if it is contaminated, and so on. So you treat it with the safest level of protection possible. So use safe work practices and best management practices. Always use your PPE, and the recommended PPE would be puncture-resistant gloves, face mask, goggles, protective clothing, and shoes, protective shoes. For the general public, discard of disposable products by wrapping in tissue before placing in the bin. Avoid indiscriminate dumping and open burning. And you may wonder, why is it open burning is important? But there is a direct link between persons suffering respiratory ills, for example, COVID, and non-communicable disease. So you'd have air pollution would definitely be an issue. Store solid waste in a safe, secure location away from animals. This is important. It needs to be securely stored because you have like wild dogs, cats may have access and may spread contaminated waste across different areas. Dispose of solid waste the first opportunity. So store it properly, and the first opportunity there is, you dispose of it appropriately. Contact solid waste management agency for proper disposal of potential infectious waste. In some jurisdictions or area, there may be prior arrangement where you could know, for example, that this is the means of disposing of this type of waste. But we're saying if you are at a home and you are caring for a person with COVID-19 and there is no such arrangement made, then maybe you could contact your solid waste management authority and say, this is the situation. I have this waste, I've properly packaged it, I've separated from the normal waste. Can you advise me how I can properly dispose of this waste? Safe management of COVID-19 household solid waste. The safe management of the waste is very important and is an essential service. Potential infectious waste in the household may include, and again, we're referring to maybe cases where you're treating potentially a case, COVID case, the contaminated masks, the gloves, used expired medicines, whatever, PPE. Kareem mentioned earlier about diapers, soil linen, anything like that would be potentially infectious waste and must be treated in that regard and must be properly packaged and disposed of. wear PPE when handling such household waste, separate such waste from the regular domestic waste, separate waste by packaging in a double bag and tie carefully, store waste safely away from humans and animals, as I mentioned before, dispose of separately from the regular household waste. So if you're not able to immediately dispose, at least keep them separate until we find appropriate means of disposing of it. Waste should be collected by specialists. That is the preferable option. Contact your local healthcare facility for proper disposal of infectious waste. Usually, since the healthcare facility would deal with it, they may be in a position to assist. So we're asking you to reach out to them should in case there are issues. Otherwise, drop off the package at essential collection point. As it relates, well, that would come to the end of the presentation in terms of water, sanitation, hygiene at the levels of and solid waste for institutions, for community, for homes. But in terms of other products that were developed, we have quite a number of other guidelines that would be useful to you guys, and they're on the CARPHA website that is here on this slide. So shelter guideline, water, sanitation, and hygiene, which we just presented. It's available also on the site. Cleaning of hotels and healthcare facility, solid waste management, fact sheets, and health and environmental impact, healthcare worker preparedness in the Caribbean during COVID-19 pandemic. So all that information and all those guidances can be found at the link on that side. We have also developed quite a number of products, infographics apart from guidelines. So we have infographics that look at COVID-19 solid waste management for the general public. We have solid waste management addressing the impact of COVID-19 on solid waste and human health in the environment. And we actually did a survey with quite a number of the solid waste management operators in the member state to look at how they deal or treat with the issue of COVID-19 and solid waste management. And the ideas that they gave us, we actually put it into a infographic poster that is available. We could also check those out. Other products include hand washing, changing of gloves, food safety and COVID-19, quite a bit of information that we have worked on during this whole period of pandemic that is available to you guys, and it is on the website and you could make very good use of it. But we're saying also that if there's any additional information that you may need, you could also feel free to reach out to us individually. We have a Facebook chat, or you could reach out to us by the link that is here, and we'll be more than willing to address any of the questions that you may ask. And now we're at the section of question and answer. Your first thing? Hmm? Which person? Which is fine. Slides? Okay. All right. Sorry about that. We're just looking at some of the questions that were placed in the chat group. If the slides will be made available. And yes, definitely we will be posting the slides. So the slides will be available to you guys. What are some of the chemicals that are used to disinfect the trucks? You mentioned that there is bleach, sodium hypochlorite. Those are usually most affordable. But then we have seen where bromine and iodine and other chemicals are used. But just to mention that in terms of affordability, we think that sodium hypochlorite or the bleach at a certain concentration, which is over 65%, is very, very effective. So I would recommend that. There is another question regarding staff member at a landfill.
Yeah,
yes, and I'll turn you over to Kim to respond to that one.
Okay, great. So we got a question, and this question was related to protocols for landfill supervisors. And the person was asking if we have protocols for landfill supervisors for their staff. So, and I'll just go back to where Bradshaw mentioned our information. So we don't have protocols. This is something that you would expect that you would get together with your administration and do. But what we have are guidelines that can steer you in the right direction. So we have a lot of guidelines with a lot of recommendations from our research, from different organizations, as well as things that are applicable to the Caribbean that we can do, and that landfill supervisor can do. And we have it in terms of looking at the actual management, the managers, solid waste managers, what they can do. We know that your staff also consists of the collectors, you know, what sort of precautions that the collectors can take, and what recommendations we have for them, and also people that work in the offices on the compound, people that actually work on the landfill sites. So we have a lot of information in terms of guidelines, and we have a lot of infographic posters, and all of this information can be useful for you when you're going to think about formulating your protocols. Because again, your protocols have to also link to what is regulation and what is law in your country, and what happens and what is pertinent to your situation in the country. So please avail yourself to all of this information that we have, because this is the whole idea of us sharing this sort of information with you. All right, so you have it at your disposal, and you can use it at any point in time. All right, so I refer you to that link there, and I also refer you to our site where we have all our infographics. So we have a range of infographic posters and guidelines. All right, I hope I did answer your question. If there's any more clarification, you could send us an email and we will respond to you as early as possible. There is another question. Okay, and the question is, should municipal waste management organization make an infectious waste collection for communities where COVID-19 is prevalent? So first of all, in communities where you have a COVID-19 prevalent, from our experience, we know that these communities usually have some sort of a quarantine system, or some, what should I say, some building or something where you quarantine individuals that may or potentially be infectious. And in these cases, what we have seen in countries, and what countries actually practice, is that they have special collection systems for this infectious waste. So for example, they have contractors that are specialized in the collection of the infectious waste. So then these operators would take the waste to another facility where it can be deactivated, for example, autoclave or incinerated, and then on to the landfill. So as it pertains to having infectious waste in communities and collections, you have to look at feasibility and cost and all of that. And I think Bradshaw did mention that you would want to go with what pertains in terms of laws and regulations in your countries according to the solid waste management agencies and what you do. So in a case like that, you would want to probably go on a hotline and talk to your solid waste management people and find out what is the best course of action. We have seen from our member states, what happens is that, what can happen is that they advise that if there's a suspected case, that you double bag the waste and you separate it from the regular waste, right? And also you leave this and you store it in a particular place for about 72 hours before disposing of it with regular waste. All right, so it all has to do with what pertains in terms of the laws and regulations in your country. So you ask also, or perhaps should there be infectious waste collection for homes under quarantine and isolation? It's specific to the case. And as I said, you would want to consult with your health officials, you'd want to consult with your solid waste management operators as well. How can the waste be collected safely? Okay, so I hope I answered your question. If not, if you need any clarifications, you can always, as I said, email us on this issue. We have another question. What is the impact on the environment of stores and offices that have installed hand washing sinks that drain to the sidewalk? Okay, this is a very nice question. I'm not sure that we have any data on this, or I'm not even sure if that is any sort of research, but as I said, this is a really good question. Just looking at the impact. So yeah, and we can actually look into that, check into that to see if there's actually any data or there's any, information on that. The next question we have, what chemicals are appropriate to sanitize agricultural products, meaning vegetables, etc.? You want to answer that? Okay, so we will put Kareem on the spot right now. So Kareem, you can take a stab at that question.
All right. Thank you guys for the questions so far. I will take a stab at the previous question before with regards to the impact of stores and offices that have installed hand washing sinks and drains to the sidewalks. Although, as I mentioned earlier, it's not best practice to have wastewater of any kind, whether it be gray water or black water, flowing into the environment. But with the case of COVID-19, let's not forget that COVID-19 as a virus that undergoes the same stresses and the activations that other viruses already go through. So if we're talking about sanitation of agricultural products or the impact of these gray waters going into our waterways, these viruses will have the same, will be exposed to the same conditions, the same stresses that would deactivate them as with other viruses. So with regards to the environmental impact on with the hand washing sinks, that's gray water. That is water, and this is a common practice not only in stores and offices that have recently installed hand washing sinks, but a lot of our showers at homes, our kitchen and bathroom sinks actually go into the drains, into the outside our home. They don't go into a separate water treatment supply. So these things are common practices as well. It'll be interesting to see the environmental impact or the effect on it. One application of this actually could be an area of epidemiology called wastewater-based epidemiology. It's a study of wastewater, gray and black water, which are known to have to carry viruses, and they are used as an epidemiological tool to monitor infection, presence or absence of infections or diseases in communities as well. So that is one avenue which it can be used. One of the shortcomings is that it's very hard to quantify using this method, as in to tell you how many households in that region, or how many households in a community would have infections, but it would give me an idea of whether there is a level of community-based infection in that area. So that is one application of that. With regards to back to the agricultural product, just remember coronavirus is a virus similar to what we've seen before. So your regular wash practices, your regular sanitation practices, your regular disinfection practices will be more than adequate to neutralize the virus and reduce the spread and contamination on transmission of the virus. And there is no known transmission of the coronavirus through food or even through wastewater, and very limited evidence of anything in the fecal oral transmission routes as well. So I hope these answered your questions that we had so far. Do we have any? I don't see any more questions at this moment, but feel free to let us know if you have any further questions via email. Again, I refer you to the survey. Please fill out the survey, and I'm going to leave it on the screen, and it's also in the chat as well. So it will be really appreciated if we can get some feedback on this in terms of how to improve, how to better deliver these tools, and whether it is useful to you at this time. So I'll hand over to Bradshaw just to close us off, and Mr. Isaac, sorry, just to close us off. And thank you again for your attendance, questions, and participation in this webinar.
So good afternoon. It was really a pleasure to host you guys. And we really hope that you found the presentation informative. Just to add that, as we have all been saying, it is not a one-off presentation, but we are making ourselves available should in case there are any other follow-up questions that we will be able to answer and to assist. I'm sure most persons are from the member states. We have 24 member states, and we are willing at all times to extend ourselves to assist in any way possible. And so we continue to be available. Thank you again for being here with us, for sharing our presentation, and for the questions. And we look forward to continued dialogue. Thanks for coming.